Hello everyone. Today we are going to learn about communicable diseases. Communicable diseases are also called as infectious diseases of public health importance. Here we are going to study about 5 communicable diseases that are prevalent in India. First is malaria, second is typhoid, third is influenza, fourth is tuberculosis, and fifth one is dengue. Malaria. According to the World Health Organization, malaria is an infectious disease that occurs due to the transmission of parasites to a person by mosquito bites that carry the infection. The parasites in mosquitoes that spread malaria belong to the Plasmodium genus. Once an infected mosquito bites a human being, the parasites multiply in the host liver before infecting and destroying red blood cells in the human body. Causative organism. Malaria is caused by protozoan parasite Plasmodium. Human malaria is caused by 4 different species of Plasmodium, that is, P. falciparum, P. malariae, P. ovale, and P. vivax. Mode of transmission. The malaria parasite is transmitted by female Anopheles mosquitoes, which bite mainly between dusk and dawn. Signs and symptoms of malaria: fever and sweating, chills that shake the whole body, headache and muscle aches, fatigue, chest pain, breathing problems and cough, diarrhea, nausea and vomiting. These are the signs and symptoms of malaria. Treatment of malaria. Treatment aims to eliminate the Plasmodium parasite from the bloodstream. Treatment includes antimalarial drugs. Medications. The most common antimalarial drugs include chloroquine phosphate and artemisinin-based combination therapies that are also known as ACTs. Prevention of malaria. Apply mosquito repellent with diethyl toluamide to exposed skin. Drape mosquito netting over beds. Put screen on windows and doors. Treat clothing, mosquito nets, tents, sleeping bags, and other fabrics with an insect repellent called permethrin. Wear long pants and long sleeves to cover your skin. Typhoid. Typhoid is a bacterial infection that can be life-threatening. The bacteria that cause typhoid is spread through contaminated food, drink, or water. Causative organism of typhoid: Salmonella typhi, S. typhi. Signs and symptoms: high fever of up to 104 degree Fahrenheit, headache, abdominal pain, constipation, and there perhaps diarrhea later. Small red spots on your abdomen or chest. Loss of appetite and weakness are some of the signs and symptoms of typhoid. Treatment. Antibiotics are used to treat typhoid. These medications kill the bacteria that cause the infection. Several different types of antibiotics are used to treat typhoid. In many cases, typhoid is treated with ampicillin, chloramphenicol, or cotrimoxazole. Prevention. Receiving a typhoid fever vaccination. Avoiding food that is raw or uncooked. Drinking only bottled water or water that has been boiled. Thoroughly washing your hands each time before eating. Avoiding raw fruits and vegetables that cannot be peeled. Avoiding eating foods and beverages purchased from street vendors. Influenza, also called flu, acute and highly infectious disease of respiratory tract. Incubation period about 1 to 2 days. Causative organism: influenza virus A, B, C. Mode of transmission: Influenza is mainly spread by droplet infection, freshly contaminated from besides direct contact. Signs and symptoms: fever up to 102 degrees Celsius, malaise, chills, headache, backache, loss of appetite are some of the symptoms of influenza. Treatment: bed rest until fever has subsided, analgesics, paracetamol, etc., dry cough suppressant, noscapine, etc. Antiviral may be given. Prevention: by administering polyvalent influenza virus vaccine, isolation of suspected case, spitting in public places should be avoided. People must be educated about healthy habits. Tuberculosis. Tuberculosis TB is an infectious disease that mostly affects the lungs but can also affect body parts like the spine, brain, or kidneys. Causative organism of tuberculosis is Mycobacterium tuberculosis. Mode of transmission: tuberculosis is mainly spread when a person with active TB disease releases germs into the air by coughing or sneezing. Signs and symptoms of tuberculosis: bad cough that lasts longer than 2 weeks, pain in the chest, tiredness, loss of appetite, loss of weight, rise in the temperature, and sweating, especially during the sleep. Treatment: drugs used to treat TB infection and disease include isoniazid, ribavirin, ethambutol, pyrazinamide, and a combination of isoniazid and ribavirin. Prevention: good social conditions, satisfactory housing, and adequate diet. BCG vaccination that is given after birth. Dengue. Dengue fever is an infection that occurs after the bite of an infected mosquito. Dengue fever occurs mostly in tropical regions worldwide. Causative organism of dengue fever is the pathogen. Dengue is caused by a virus of the Flaviridae family. Signs and symptoms of dengue: strong pain behind the eyes, severe headache, muscle, bone, and joint pain, rashes, and mild bleeding. Treatment of dengue: there is no specific treatment for dengue fever. Pain relievers such as acetaminophen and drink a lot of fluids is advisable. Prevention: use mosquito repellents that contain 20 to 30% DEET. Wear long clothing outdoors, especially at night when mosquitoes are more likely to be active. Remove standing water, buckets or barrels, bird baths, old tires that may hold rainwater, and fill low spots where water can pool. Thank you.